Every week, Thomas Gooch and his team drive to Nashville's tent city, providing services today that could be gone tomorrow.
Okay, and what did you need today, bud?
Rigs.
Do you have any rigs to turn in?
Gooch, as he is known in the streets, provides harm reduction services, including needle exchanges and HIV tests, through his organization HOPE, helping other people effectively, in partnership with Meharry Medical College.
These are the fentanyl strips, and these are the xylazine strips.
These strips, along with other harm reduction practices, like the availability of Narcan.
Yeah, Narcan.
Saving these two teens' lives and many more.
He's got full.
The nation's seeing a 27% drop in overdose deaths last year, finally coming down from record highs, with Tennessee outpacing the rest of the country. Experts say the massive decline could be due to many factors, including the availability of drugs like Narcan. Health Secretary Robert F. Kennedy Jr. says he's still in recovery from a heroin addiction decades ago and came here to Nashville just last month.
We need Suboxone, we need methadone, we need naltrexone, we need Narcan.
But that need may become harder to fill. His boss, President Trump, proposed 2026 budget cuts of more than $1 billion to the Substance Abuse and Mental Health Services Administration, or SAMHSA. Gooch's program supported in part by those funds.
We got 4 or 5 individuals that used to work closely with me. Probably after the end of next month will not have a job no more.
The Trump administration says harm reduction programs like safe smoking kits and syringe exchanges are, quote, dangerous activities. And they've long been the target of criticism.
It's very concerning to me that we're giving out needles, for drugs. I think to me it's poor use of taxpayer money.
Technically, taxpayer money can't be used directly for buying needles or syringes, but federal funds can be used to support the services. And the CDC itself calls needle exchange programs proven and effective, pointing to research showing those engaged are more likely to enter drug treatment programs and stop using. Gooch hasn't used drugs in 22 years, and beyond the stats, sees the human side.
You can't help a dead addict. Let me give you clean supplies until you make a decision to do something different.
And when they make that decision, SAMHSA also supports long-term recovery programs like Mending Hearts for now.
What do you think that would do for the community? If you didn't have the money to keep going, you would have at least 500 women a year on the streets, raising your overdose rate.
This nonprofit provides free care for vulnerable women in recovery and says it gets 60 to 70% of its funding from federal grants. Clinical director Yolanda Manus was once a client herself.
Now, when they're in this house, they have completed all clinical services. They have a job.
Right now, the program houses women up to 2 years from detox to self-sufficiency.
You cannot take 30 days to correct a 10-year drug addiction.
The current proposed cuts aren't directed at these long-term services, but there's increasing concern they'll be impacted through agency restructuring. We reached out to HHS and the White House for comment, but have yet to hear back. HHS saying in a recent press release the shakeup, quote, will increase operational efficiency. Mending Hearts founder Trina Frierson says if the cuts end up coming for them,
we've already been impacted in our city by some of these. And so we would definitely have to cut back on some services.
Gooch and his team are going to keep working until the money dries up.
With them showing up, it gives us hope to know that there are people who still care about us out here.
If an individual come to us and say they want to go to treatment today, so we talking about letting them get on this RV or get in one of our vehicles and drive them.
Hoping the trust they're building will put their clients on the path to recovery.
So, Hal, the big question is which programs are going to be cut, right? And we don't have a lot of information beyond what the White House released in its budget proposal, which isn't really specific. NBC News did obtain kind of this draft budget document that was circulating on the Hill last month. It was put together by the Office of Management and Budget, included a proposal to eliminate a number of HHS programs, including one, Hal, first responder training for naloxone or Narcan, right? We know that to be a $56 million program from SAMHSA's website. HHS referring us back to the president's budget. None of this, by the way, though, I want to remind folks, it's not set in stone, right? What we saw is just a draft, not a final document. Congress still needs to approve this budget. A lot can change, but it's numbers like that, Hal, which has those providing these services nervous about what is to come.
Yasmin Vasugian, thank you so much for doing that reporting for us. Appreciate it.
Thanks.
If you or anybody you know is struggling with addiction, there is help. You can call the National Helpline 24/7, 365 days a year. 800-662-HELP 4357.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.